Hello and welcome to part 1 of this webinar series, Upper GI Tract and Peptic Ulcer Disease. My name is Moyo Olukoga. I'm a final year medical student at Lancaster Med School, and this is brought to you by Medics.Academy's virtual elective. I've had a really good experience and I'd recommend you sign up and click the link below to find out some more information. This is a 3-part webinar series, and today is part 1, Upper GI Tract and Stomach. Make sure you click in the link below to watch parts 1, part 2, and part 3 of this video. Also, for this session, you will need 2 different coloured pens and paper. So let's begin. This is an overview of the upper GI tract and the histology. It's important to understand the histology so we can understand how different organs in the GI tract works. So let's begin with the innermost layer, the mucosa, which we can see here. This is composed of epithelium, lamina propria, and the muscularis mucosa. It's in direct contact with the food. The next layer, which surrounds the mucosa, is the submucosa, which you can see here in brown. It contains different glands which secrete things like enzymes. These pass through the duct into the mucosa and the lumen. Also, blood and lymphatic vessels are found in the submucosa, and it's innervated by the submucosal plexus. The next layer is the muscularis. This is just a muscle layer. Here we can see there's an inner circular muscle layer covered by an outer longitudinal muscle layer. And this is innervated by the myenteric plexus. This allows peristalsis, so the food can travel down the GI tract. The final layer is the serosa, which we can see here in the light beige colour. And this consists of areolar connective tissue, epithelium, and visceral peritoneum. And this is important for suspending different organs in the GI tract within the abdomen. So to summarise, we have 4 basic layers and they vary according to organ. Now let's begin to look at the stomach. The stomach is an intraperitoneal organ, and it's located in the epigastric and umbilical region. The 4 main anatomical regions are shaded in different colours in this diagram. The pink shows the cardia, which is the opening of the stomach, connecting it to the esophagus. The yellow shows the fundus, and this is often filled with air. The purple section is the body, and this is the main bulk of the stomach, while the blue section is the pylorus, connecting the stomach to the duodenum and containing the pyloric sphincter, which when it contracts, it stores the food contents in the stomach. Now here you can see a lesser curvature and a greater curvature, and this is important for something called omentum. So if you remember back to our histology, the serosa is the outer layer, and this can fold into something called omentum. The omentum from the lesser curvature joins the stomach to the liver via the lesser omentum, while the omentum from the greater curvature folds down and joins the transverse colon through the greater omentum. So now it's time to get your pen and papers, and we're going to draw through the arterial blood supply to the stomach. You can pause the video here while you get your pen and paper, and I'm just going to get my whiteboard. So we're going to begin by drawing 2 vertical lines, one here and one here. Then we're going to draw a small backward C like so, and then a bigger backward C like so. Finally, we're just going to draw 2 more vertical lines down. And as you can see, this is our makeshift stomach. Now it's time to get a different coloured pen, and we're going to draw the blood supply. So coming off the abdominal aorta is the celiac trunk, which we're just going to draw as a circle and label. The celiac trunk has 3 main arteries, which we're going to draw on. The first is the left gastric. That goes up here and supplies this portion of the lesser curvature. So let's label that. And let's just draw an arrow. Next, we have the splenic. This goes through the back of the stomach, supplying the pancreas, and continues its way to the spleen. The final branch of the celiac trunk is the common hepatic artery, and this goes towards the liver, and it gives rise to a variety of different branches which we are about to label in a moment. So just to recap, we've got the left gastric, the splenic, and the common hepatic. Coming off the common hepatic, one of the first branches is the right gastric artery. So this supplies the rest of the lesser curvature. We then have another branch known as the gastroduodenal. This travels down the GI tract and it splits into two branches, one here and one supplying this portion of the greater curvature. So let's label it. So gastroduodenal arises from the common hepatic. It gives rise to a branch which goes to the duodenum, which we won't label right now, and it gives rise to this branch, the right gastromental. Next, we have a branch coming off the splenic artery, and this anastomoses with the right gastromental, and it's named the left gastromental. Finally, what we have are short gastric arteries coming off both gastromental branches, and this just goes to supply the main body of the stomach. So let's finally label this last one, short gastric. So I hope this demonstration was useful to you. It's something that's really good to practice and you can quickly jot down in exams if you ever struggle to remember the blood supply. Now let's go back to our presentation. So in true Blue Peter style, here's one I drew earlier. Now we're going to take a look at the venous drainage. So it mirrors the arterial supply, but it's much simpler. What we have here is the left gastric and the right gastric draining directly into the hepatic portal, while the right gastromental drains directly into the superior mesenteric, and the left gastromental joins the splenic, which later joins with the superior mesenteric vein. Now we're going to have a look at the histology specific to the stomach. If you remember earlier, I mentioned that there are two muscle layers. However, in the stomach, we have three. Starting with the innermost layer, we have an inner oblique layer, a middle circular layer, an outer longitudinal layer. And these three layers are key because it allows mixing and mechanical digestion, producing chyme. And chyme is just what happens when the food enters the stomach and it's mixed with the gastric acid. Let's take a look at the mucosa. So in the mucosa, we said earlier, there are epithelial cells. And in the stomach, there are a variety of different epithelial cells, each contributing a different function. So beginning with the yellow and orange, we have the surface mucus and the mucus neck cells. These simply secrete mucus, which protects the stomach against the gastric acid. Next, we have the parietal cells shaded in pink. This secretes hydrochloric acid, which denatures protein and kills bacteria. It also secretes intrinsic factor, which is important for the absorption of vitamin B12. Finally, we have chief cells shaded in blue. This secretes pepsin, which also denatures proteins, and gastric lipase, which digests triglycerides. Our final cell is the enteroendocrine cell, and this secretes a hormone called gastrin. This stimulates the production of hydrochloric acid and secretion. Finally, we're going to take a look at how hydrochloric acid is produced, because in part 3 of this video, we'll look at peptic ulcer disease, and this is a target for a proton pump inhibitor. So In the parietal cell, we have carbonic acid, which is just water and carbon dioxide associated together. This splits into hydrogen ions and bicarbonate ions. Here we have an ATPase proton pump. The hydrogen ions are exchanged for potassium ions entering the lumen via this pump, while bicarbonate ions are exchanged for chloride ions entering the blood. As chloride ions come into the parietal cell, they travel through this chloride channel to enter the stomach lumen. So now we have hydrogen ions and chloride ions in our stomach lumen. So as they associate together, we've got hydrochloric acid. And just to reiterate, this ATPase proton pump is a drug target for proton pump inhibitors. This brings us to the end of this part. The arterial supply to the stomach is from the celiac trunk. The venous drainage is through the hepatic portal, superior mesenteric and splenic veins. The stomach contains 3 muscles, aiding mechanical digestion and the secretion of hydrochloric acid and enzyme in the mucosa digests food. Thank you for listening. If you have any questions, feel free to email me at simplymedics@gmail.com or at simplymedics on Twitter and Instagram. Please make sure you follow what my colleagues are doing by clicking on any other video on this channel. Make sure you subscribe and like to the Medics.Academy YouTube channel so you can keep up to date with the latest videos. Finally, if you're a medical student, make sure you sign up to the free SDocs program. The link is in the description box below. Thank you.